It's just the latest addition to the ever-growing list of words most of us have gone from never using at all to using hundreds of times a day. Omicron. That, of course, is the COVID variant first discovered in South Africa last week, which has prompted a lot of concern over both how well vaccines will work against the new strain and how quickly it would spread among the unvaccinated. To that end, the Biden administration banned people from traveling to the U.S. from South Africa and several neighboring countries this week, a move the president defended yesterday after some argued it punished South Africa for being transparent about their cases.
Here's what it does. It gives us time. It gives us time to take more actions, to move quicker. We needed time to give people an opportunity to say, get that vaccination now before it heads. It's going to move around the world.
Vaccination is going to be the solution to this, whether it's the Delta variant or whether it's the Omicron variant. Vaccination is going to be the solution.
And that's why the CDC updated its booster shot guidelines yesterday, now recommending all adults get the additional shot. And Pfizer is expected to ask the FDA this week to approve boosters for kids 16 and up. Of course, 30% of people in the U.S. still haven't even gotten a first shot, which is why several states, including Massachusetts, are working on a digital verification system to prove vaccine status, as Governor Baker told us yesterday on Boston Public Radio.
It's a universal standard, and we've been working with a bunch of other states. There's probably 15 or 20 of them to try to create a single QR code that can be used for all sorts of things, where people may choose to require a vaccine.
How close is that deal?
Soon.
Joining me is Dr. Paul Sachs. He's the clinical director of the Infectious Disease Division at Brigham and Women's Hospital and a professor at Harvard Medical School. Dr. Sachs, good to see you. Thanks for being here.
Thanks for inviting me.
So Joe Biden said yesterday, cause for concern, not panic. Based upon what you know so far, and obviously so far, what conclusion do you draw?
I'd have to agree. We have to follow it very closely, but right now there's no indication that the vaccines are useless, which of course is the biggest fear. Probably they are protective against severe disease, even if they're not as protective against infection totally. Keeping people out of the hospital, keeping people out of the ICU, keeping people alive is still a very, very valid endpoint for these vaccines. And I especially think that's the case with the boosted vaccine. The third dose of these vaccines seems to provide really exceptional protection.
Well, let's talk about the vaccines for a minute. First, here is the Pfizer CEO yesterday talking to CNN about vaccines.
We don't know if it's going to be more virulent. We don't know if it's going to transmit faster or have higher disease. We don't know if it will escape the protection of our vaccines.
Well, speaking to the Financial Times, the CEO of Moderna seemed to know, according to him. There's no world, I think, where the effectiveness is the same level we had with the Delta variant. I think it's going to be a material drop. I just don't know how much because we need to wait for the data. But all the scientists I've talked to, he says, are like, this is not going to be good. You seem to think the Pfizer CEO is closer to right.
Well, we did have variants that displayed immune evasion before. Remember, the beta and the gamma variants did have immune evasion as one of their properties, but they didn't have as much transmissibility, and they never really took off. It really was Delta's transmissibility that caused the surges that occurred here in the United States this summer and now into the winter. So it really remains to be seen whether this vaccine evasiveness property is going to render the vaccines less useful. It may be that they offer almost as good protection. I was encouraged by this piece that was released from Israel today saying that there's already evidence that they offer some protection. I think we're going to have to wait for some more data before we panic. I really think it's important that we not panic.
And your advice, from what I read somewhere, is don't wait for the tweaked booster, as the Pfizer and Modernas are talking about. Get the one that exists now, correct?
Yeah, absolutely. People should understand that it's going to take several months before those are available at the shortest interval. And even then, it's not clear that it's going to be required. So as a result, I'm recommending that definitely adults who are eligible for their third dose get that third dose. As I've mentioned, that's the highest level of immune protection that we've seen with any strategy. And there's really also no indication that this third dose is more harmful or has more side effects than earlier doses. So by all means, go ahead and do it. I think when we look back on this history of the vaccines for COVID-19, we're going to say these vaccines initially should have been 3 doses, and that should be the primary series.
There's also no indication, to use your terms, that the variant is even here yet, but there's no doubt that it will be. Is that correct?
Yeah, that's a fair assumption to make. As you've probably heard, now there's evidence that it actually was in Europe before the South Africans discovered the virus. I'm sure it is spreading because this virus we know spreads. And you might have seen that very amusing cartoon of people standing at their doorway with the variant outside, and they have the door locked, and then they turn around and they see it's already in their house. I'm afraid that that's likely to be the situation with this variant. What's not clear yet is how widely distributed it is, or whether it's going to cause yet another surge of COVID-19.
You know, you reiterated what the president said about no time for panic, but based on my limited scientific knowledge, and I do mean really limited, what is something like more than half of the world's population is unvaccinated. I think it's 44%, I think I saw in the Times yesterday, fully vaccinated. So what I've learned about fertile territory for mutations, it seems to me that even if Omicron turns out not to be a cause for panic, ultimately there will be a variant that is cause for panic unless this vaccination thing picks up steam big time, not just here in the US, but more importantly around the world.
Yeah, vaccination globally is going to help everybody. You won't find a single scientist who doesn't believe that. One thing that we're very lucky in this country, is we have an abundant supply of vaccines. So I strongly encourage people to take advantage of that. But also policymakers definitely need to move towards getting the vaccines to the places that need them the most. This will not deprive us. We have enough supply here. I think this is very important for global health. It's very important for our health too.
But the absence, I want to be clear though, the point I was trying to make is the absence of vaccinations, wherever they are, is going to continue to breed mutations, whether it's Omicron that causes great damage or not, correct?
Well, it is true that it's generally been observed in unvaccinated people, in particular people who are immunocompromised to contract COVID-19, and they have these prolonged syndromes where they have the virus for weeks or even months at a time. It's in that context that we've seen variants emerge. And it's plausible that that's what happened with Omicron as well. We can never, specifically say when it happened. But it's that population who contracts the virus, who seem to generate the variants, and they're much more likely to contract it in a population that is less vaccinated.
You know, I know that vaccinations are not only at the top of your list, but virtually all of your colleagues. On my list, right below vaccinations, is testing. And I know I'm not alone. Over the Thanksgiving weekend, about to go to people's houses, try to find rapid tests at home, went to maybe a half dozen drugstores till I found something. Then when I found them, they're $24 for 2. I can afford that. A lot of people cannot afford that. Isn't the critical ingredient in the ultimate fix here is the federal government getting as involved in making rapid tests available and affordable, if not free, as they did with vaccines?
I can't agree with you more. They're really valuable tools. I've heard about cases just over the holiday weekend of people who are planning to gather, and their healthy teenage or young adult child was planning to join them, and they tested and were positive on a rapid test. We had very mild or minimal symptoms, and that's probably when they're most contagious, is the day before the symptoms develop. So, I strongly encourage people to make use of these. Unfortunately, right now, it takes quite a bit of health literacy and financial resources to do so. As you mentioned, they're $24, $25 for 2. And in addition, you pretty much have to go online to get them because the pharmacies and other stores are always out of them. It's a huge problem, and one that's been extremely frustrating for all of us.
In the introduction, we had Governor Baker on our radio show yesterday talking about the possibility of a vaccine passport here. A couple of days before that, a new Mayor Wu was on our radio show and said she was seriously considering doing what New York City, Los Angeles, other places have done, requiring vaccination to go into restaurants, performance venues, etc. Is that not a good idea?
It's a great idea. What happens if you have everybody vaccinated in a setting like that is, even if there are breakthrough cases, You're sparing the most severe outcomes, and you're avoiding the kind of super spreader events that led to the Biogen disaster back in the spring of 2020. We know that a vaccinated population can still get COVID-19, but is less likely to have it. So all of these together, if people want to have the freedoms again and the safety to gather indoors in higher risk transmission settings like restaurants, concerts, et cetera, having those vaccine passports makes a lot of sense from a public health and personal health perspective.
Can we end where we began? I asked you, based upon what you know so far, what conclusion you draw. When will you and your colleagues know enough to make a final conclusion about Omicron and what kind of threat it poses?
So I've learned several months ago not to make definitive predictions about this pandemic because they're always wrong. And I'm not going to go back on that promise to myself. So information is going to come in very rapidly over the next couple of weeks, and we'll have a much better sense. Right now, it's too soon to make definitive predictions. I'm sorry to let you down there.
Well, I appreciate your honoring your own pledge. Dr. Sachs, thank you so much for your time. I really appreciate it.
Thanks for inviting me on.